Hello, I'm Marie, one of the aesthetic providers here at Alii Nani. Today, let's quickly talk about the temple. Alright, so you probably heard of the term peanut head or that concavity or temple hollowing that happens as it relates to aging. So there are different ways how you could address that. I would say temple is one of the most underrated areas on the face wherein we're not really paying much attention, but addressed correctly, it really gives a very youthful appearance to somebody my age, for example. So what can you do? So one of the top treatments to consider is derma fillers. So you can either inject with hyaluronic acid or with a biostimulator like Radius. However, if you are a new injector, I would advise against treating the temple right away, only because it is such a risky and tricky area to treat. You really have to know the anatomy. As small as this area, it has 10 layers. So you have to know where to safely inject and how to safely inject. Be aware of the vasculature because of the high risk for blindness due to close proximity to the eyes. How do I address the temple? I use the ultrasound first in order to map out this important blood vessel so that I know where to inject safely. Number 2 is I use a 22 gauge cannula. I inject subcutaneously. And the third one is do not overfill the temples. It's always best to undercorrect, evaluate after 2 weeks, and then build from there. And one last thing, if you are doing the cheeks, say for example for the lateral portion, you also have to consider the temple, so you do not have what I call the floating cheeks. When everything blends in, then your filler will look fantastic, will look natural.